All right, guys, episode 441 with Dr. J. Faber is brought to you by a couple really cool products that I really like a lot. One is activation products. And if you guys are unfamiliar with that, we've got a bunch of videos as well as the interview that we did with the founder, Ian Clark, on our store, as well as a bunch of different videos about how he goes about creating his products. And his products are amazing. Magnesium, as many of you guys know, is one of the most abundant minerals that we need in our body. It's also the most depleted mineral that human beings have because almost every active biological process in our body uses magnesium, and so it gets used up. And when magnesium gets used up, all other systems starts to fail. It's just a great, great mineral to take on a daily basis to calm your senses, to calm you down, and to help many other biological processes happen that use and rely on magnesium. So if you're stressed, if you're worried, if you're anxious, magnesium is the mineral for you. So I'd highly recommend checking it out. Watch the videos that are in our store and listen to the interview we did with Ian Clark. And he's also got the Oceans Alive Pure Marine Phytoplankton, which contains all 92 minerals. Now, this is better than organic because these are biologically absorbed into the body, all these minerals. Not even organic food has 92 minerals in it. So this is an incredible way to electrically charge your body, to get incredible nutrition, and all 92 minerals that we need to exist as human beings on this planet. The marine phytoplankton and the magnesium are just awesome. So check those out. And this show is also brought to you by the Good Morning, Good Evening Qigong. Now, Qigong is an ancient practice that's been used for thousands, over 4,000 years in China and in the Orient. It's a longevity exercise. But what it does is it helps to ground your energy. So if you're someone who feels ungrounded, or you feel like people can come in and talk to you and you really are empathetic with them, and your emotions get taken away and you get angry or you get upset or you feel all this stress and anxiety. Qigong is an ancient sort of practice that people have been doing. It's it's a way to build your energy and build your life force, as well as harness it and ground it so you're strong and you're emotionally strong and you feel like you've got purpose in your day. It takes 10 minutes in the morning, 10 minutes in the evening. It's all it takes, and I do it every day. There are days I miss, but for the most part, I do it every single day. When I miss it, I really don't like missing it because I love what it does for me. So if you're interested in the Oceans Alive, the marine phytoplankton, the magnesium infusion, as well as this Qigong course, go check out extremehealthradio.com/441, and you can also check them out in our store and watch more videos about them there too. So we appreciate that. All right. Thanks for listening. Let's get on to this episode. All right. Happy 4th of July, everybody. It's July 4th, 2016, and here we are today doing a show for you guys, and I hope you guys are all having a great 4th of July.
And safe.
And safe. Not blowing off your hands? Or
Gosh. We saw, unfortunately, we had that happen a couple of years ago with some people in our town. A couple firemen, unfortunately.
Was it really? They blew their hands off?
A couple fingers each. And
oh, my goodness.
Yikes.
Firemen, you would think they would be well-trained.
You'd think. Wow. They think they're invincible sometimes, unfortunately.
Maybe they just took the day off.
Yeah, right? Oh, wow. Gosh. Scary.
Well, today we're going to be talking about mental health and brain health, and this is a huge subject. We've got Dr. J. Faber on the line. This is episode 441. This is a big issue in today's culture, today's society. About 26%, 1 out of every 4 people is dealing with some sort of diagnosable neurological brain disorder, which is amazing, which maybe explains road rage or traffic accidents.
Gosh.
I mean, that's 1 out of every 4 people you run into driving down the freeway.
You know, I kind of believe it. Doing 16 years of salon work, doing hair for people, and coming across, people have some really deep-seated stuff. It's heavy. Yeah.
So if you know of, or if you yourself are dealing with anxiety, mood disorders, depression, OCD, temper issues, addictions of any kind, negativity, bipolar issues, ADHD or ADD with concentration issues. Maybe you've had a concussion or a traumatic brain injury. The Alzheimer's rates are skyrocketing in today's culture. Poor memory, and as well as something we talk about a lot on the show, autism. These are all brain issues. And so Dr. Jay Faber's on the line, and he's a clinical and forensic psychologist with a couple decades of experience in child, adolescent, and I can say this, adult psychiatry and pharmacological management. Treats patients, clinical patients, private practices in Colorado, California, and Georgia, as well as being the president of Brain Source and working at the Amen Clinics here in California. He's teaching adolescents how to build successful lives with an entire program that is just launching. So we're excited to have Dr. Jay Faber on the line. Thanks so much, Doc, for being on the line with us.
Thank you, Justin. It's great to be online with you too.
And thank you again. I know that we said this a little bit before we started the show, but thanks for joining us on July 4th.
Happy 4th.
Yeah,
Happy 4th.
Appreciate that.
Yes. Way to start the day.
I know, right?
Yes.
Nothing wrong with that. So you've been at this for a couple decades, working with in psychiatry at least.
Yes, that's true.
That is amazing. So where did you start your practice? We were talking before the show about how you were formerly in Georgia. Did you start out there, or did you start in California?
No, I graduated medical school, University of Minnesota, did 4 years of adult training at Faber, UCLA, stayed around an extra 2 years and did a child and adolescent fellowship at Faber, UCLA. I moved away to Colorado for 3 years and got an opportunity to do a forensics fellowship at the USC, Southern California, not South Carolina, Institute of Psychiatry and Law during the People versus OJ trial.
Oh.
Yeah, so it was like, how can you turn that one down?
Right.
I know, right? That's the biggest one ever.
Yeah. So I moved back. I did a year there and then moved to Georgia for about 20 years. I loved California. I had some other goals, particularly in mind, and because my social life in LA was becoming so busy, I needed to take a step back, become a bit more introverted, and have a learning mindset. Hence, this is sort of where Brain Source started, to learn the skill sets necessary to get that off the ground.
So Brain Source has been going for the entire duration of your career.
It's gone 20 years. It's gone in hibernation for the last 5. But come January 1, 2017, I'm going to be starting the company again here in California.
Oh, great! Is that related to the to what you were just talking about before we started recording, the place where you're going to be helping teenagers in LA? Is that related to that?
Yeah, it's indirectly related. You're talking about the Bony Pony Ranch?
Yes.
The foundation. Yeah. So for the listeners, a good friend of mine, Dr. Frank Ryan, who was a plastic surgeon up in Beverly Hills, literally, was a plastic surgeon to the stars. Tragically passed away about 4 years ago. Before that, he had a ranch in Malibu called the Bony Pony Ranch, where children who had gotten themselves in trouble with the law and got their acts together, got to go up to the ranch in Malibu and learn success principles with Dr. Ryan, as well as a lot of notable and well-known celebrities. When he passed away, so did the ranch, unfortunately. I moved back 6 months ago. One of my goals was to get the ranch reinvigorated again. So long story short, I met with the administrative assistant to the ranch about a month ago. We are in the process of setting up a 501(c) to get this up and running again. One thing we're going to be doing a bit different, at least initially, Dr. Ryan had the children go up to his ranch in Malibu, and they'd have all sorts of fun up there. We thought instead is, rather than have the kids come to us, let's go meet the kids where they're at. And so one of the things we're going to do is look at purchasing a house in the quote-unquote hood, and then design the interior such that it becomes more of an urbanicity, trendy, edgy place where kids can come, and maybe family too, to do two things. One is and this is really twofold. I think this is kind of where we're at with the country, where we can teach the kids, but simultaneously they can teach us as well. I know some about the hood, but I'll be honest, I don't know everything. And I think as I get to know some of these kids, and the foundation does, I think we're going to become rather surprised and humbled on what these people go through and what we need to do as well as they to make this world a better place. So, for example, this is be one example. One of the things I want to do with this house is make a really cool kitchen. And I want to get some of the people on our board who are into aesthetics and design to come in, look at the house, and then make a special kitchen where there's granite countertops, put in Viking appliances, make it really cool looking, exciting, and then use that as a template to figure out how we can help individuals eat more healthy. The obesity rate with kids is running about 30% right now. And I don't understand all the details, but the more we get to know the kids, build relationships, we'll learn. Then with that knowledge, would it not be cool to take somebody like Tina Amon, who wrote the Omni Diet, New York Times bestselling book, or somebody like Wolfgang von Pock, have them come out to the house, have the kids sit in the kitchen with them, and they playfully make a healthy meal for all participants to eat between, seminars on how to live life at a higher level.
That's so great that you're doing that because so many people, it's so easy to just judge and I don't have all these negative thoughts about kids that are in the hood. But if you go through, like you're saying, that's so great to be able to learn from them. Because that it almost seems like a normal response for the way they live. If we were all exposed and had the same history of, their father beating their mother or their father running away and all of these things, and we live where they live, there's so much going into why they're acting the way they are. And I think it's so great for you to, learn from what's, how their life has panned out.
It's interesting. This could be a whole nother topic just on how we polarize. And we all feel good about it because then we get to be right. But it doesn't solve the problem. I did a radio show in Atlanta about a month and a half ago with David Lee Windisher. David is a defense attorney who is a literal transphobe Miami gangster thug.
Oh my gosh.
Yeah. He just wrote a book. Tyler Perry, in fact, has signed some contract. I guess they're looking at doing a movie of his life. But anyhow, long story short, I met with David and Judge Asa Jackson in Atlanta. And on the radio show, one of the things they mentioned was you've got these policemen stopping people on the streets because of the way they appear, the way they dress, the way they look. So they have to stop to ask questions. Subsequently, what happens? These teenagers become defensive and angry because they're not doing anything. They're just being kids. And then all of a sudden, you've got a polarization. You've got police who think they're right, and in some ways they are. And then you've got the kids who think they're right, and you know what? Some ways they're right as well. So what do we do? Okay, so this is one of the things we talked about is for those who haven't seen Straight Outta Compton, I would highly encourage it. I think it gives us a little breath of what goes on in our inner cities. But would it not make sense to have some conversations with the police and the kids in these communities together to kind of give each other their mindset? And then after that, have them all sit down, watch a movie like Straight Outta Compton together, stop it at different points when they have some of these, what I would call very intense conversations, or for lack of better words, maybe interrogations.
Arguments.
To see how both parties could communicate in a way that leads to more of a resolution than a polarization.
Yeah, that sounds amazing. That would be a great way to do that. I think it's so interesting. It's 2016. How have we not thought about this before?
Well, I think this is just my personal opinion. We as humans become very attracted to our intense feelings of wanting to be right. And because of that, we become glued to TV sets, cable networks, etc., based upon those opinions. It gives us a sense of we're right. Some of our gut and feelings, I guess they were correct. Well, they might be partially corrected, but the problem is this. We don't solve problems. And what we need to get, I think, is mediators who are strong. Okay, I think a lot of times mediators are seen as kind of weak, kind of moderate people. No, they're not. And if they are just being weak, then we need to find people who can really stand up for that process of communication so that we can help our communities become less divisive, less segregated, and more cohesive and unified. This is America. We're one of the few places in the world that has this opportunity. Would it not make sense for us to not only talk about it, but show examples of how it's done?
Yeah, so, it would make a lot of sense. It would make a lot of sense. So when you're working with a child, by the way, was that, before I ask you that, was that statistic correct that I pulled off the internet? About 26% of people are dealing with some sort of mental issue?
Mental health issue or substance abuse? Yes. That's
20.
I think pretty correct.
That's amazing, because if you think about that, like we're saying at the beginning of the show, that's 1 out of every 4 people. But then I'm not sure what the statistic is. I think it's 1 out of every 3 or 2 people are on some form of pharmaceutical medication. So then you have, gosh, I mean, that's just about almost every second person you see.
I'll give you even another perspective. I used to work with a large insurance company, and the CEO, she's brilliant. We had one of our big meetings, and she said, okay, I would like everyone here to raise their hands who's got a family member or themselves who suffers from breast cancer. And about 1 out of probably 11 to 12 people rose their hand.
Okay.
Then she said, now I would like everyone to raise their hand who has somebody in their family, or if you're brave enough, you have a problem with alcohol, substance abuse, or mental health illness. And just what you just said, 1 out of every 3 to 4 people rose their hand.
Wow.
It's like, this is how pervasive it is. And why aren't we talking about it?
Do you think that this has always been, or do you think that this is a byproduct of our society and the fast change and people not being able to grasp what's happening around them in times like this?
Yeah, that is a great question, and I'm not sure I have a good answer for that, but I would say this. Just from a scientific perspective, I am a doctor, so I kind of put it in. I think you've got an interaction between our genes and how we produce neurotransmitters, hormones, etc., and what society has going on out there. So, I mean, that could be anything from the foods we eat to not being able to pay our bills to watching violence on TV. There's a relationship both internally and externally that I think leads to our brains wanting to calm themselves or function better.
And like you said, those issues, as well as well, you said this, paying our bills. I mean, financial struggle, financial stress is a massive one in today's culture. Everybody's stressed out and working, and they want to sort of numb the pain, so they don't think they have an addictive personality. I don't think people realize, like, before they start doing drugs or they start drinking, I don't think they know that they have addictive personality. It's just that they want to sort of numb the pain, and that's what everybody else does.
Right, they're not setting out to become a dependent
alcoholic. Yeah, they don't set out for that. But then once they start doing it, you only realize after that you're addicted to these things. And then if you're not careful, it just leads down a path where 20 years later, you're wondering, what the heck did I do with my life?
Yeah, I mean, the funny thing is, when you start doing those types of behaviors, there's usually not immediate consequences.
Oh, right.
And then all of a sudden, something happens, you get DUI or, you get busted with some drugs at work, and then you got all sorts of problems. It's like, oh my gosh. So yeah, the awareness factor, I think, is really important. And
is most of this stemming from teenage years for people, have you found?
I think it's part of it. I think in some cases it might be even earlier, depending on the attachments you've got with your mom and dad early on. I mean, there's lots of studies on that. There's, grade school bullying, middle school bullying, high school. So, yeah, I think you set a template early on that certainly puts you more at risk for those types of illnesses. The other thing, too, that I find fascinating is how our society, we recognize these issues, but simultaneously, would it not make more sense to also look at ways to increase resilience, increase hope, increase optimism? There's lots of great material coming out in the press, business books, leadership books, etc., that if we were somehow able to harness, utilize it in a pragmatic way to help parents teach their kids, I think it'd make a big difference.
That's the key, right? Is making it sort of like what you're doing with the with the home, is making it cool, making it edgy, and that's the case when you have a 12-year-old boy.
They got to be drawn to this.
They got to be drawn. Naturally, he's not going to be interested in success principles, but if you can wrap it up in something really edgy, like what you're doing with the home. So when you're working with kids and you see someone and you want to see them go in that direction, but first you have all these issues that they're dealing with, do you spend time with the child or adult, I guess, fixing what could be wrong with them, and then after that is sort of leveled out, then you begin to introduce some of these success principles to them?
In a way, yes, but I really think you have to be empathically attuned with that child's resistance.
Okay.
The more you understand that, you don't have to agree with it, but just understand that, and then with that individual, acknowledge their struggle. It's like, this is a tough decision. I mean, you could go hang out with your friends, that are using drugs and alcohol and have all this fun, or you can sit and study, and you want to study and do these things, but yet you get all this fun. It's like, what do you do?
That's the hard part, right?
Right.
What a struggle. So you connect with them in their struggle. And once you create that relationship and they know, gosh, they understand me, they connect, then you can start to weasel into some other areas to teach them, hey, maybe there are some ways to have fun and not use drugs or alcohol.
Yeah, they're looking for connection, right? First.
They want connect. I mean, it's like relationship. It's, I think, even more today than ever. It's so important in knowing how to constructively build those bridges. And we talk about it, and we make it sound like it's easy. Well, guess what? It's not easy. I find myself humbled every day learning new skill sets on how to create those bridges.
Yeah, you can just walk around and interact with people, and people don't want, someone judging them and telling them how to live their life. It's just not part of, what we want is connection, relationships, and feeling like we have some sort of trust and camaraderie together. And then once that's established, then, you can start offering bits of little nuggets every now and then in people in our personal lives, but it seems like it would be perfect for what you're doing.
Yeah, no, so that's it. It helps a lot. So that way, when you empathize with their resistance, then you start to build from there. So
I'm looking at this list here. I love what you guys are doing at the Amen Clinics, and it's just fascinating because I'm reading this list of anxiety, mood disorder, depression, OCD, temper, negativity, and addictions, and all this stuff. And these are all some of the things that you deal with. Is probably not a complete list. But I was really intrigued at the way you guys are going about treating people, because from what I understand, most disciplines in terms of like medical or other sort of disciplines like that, they'll look at a scan or a bone or a fracture, or they'll do an MRI of some part of the body and then make a determination as to which way to proceed. But psychiatry, correct me if I'm wrong, simply does a lot of guesswork and says, okay, here's a medication for you. Is that correct?
Yeah, I mean, just historically, other like cardiology, GI, they've had the ability to use other non-invasive investigative techniques. And studying the brain, we haven't had it. MRI, we got some, but we, from a psychiatric standpoint, my own personal opinion, we haven't been able to use technology as well as other fields. But I think we're catching up. Mm-hmm. And we're seeing some of the fruits of that, at least in our clinic, I think.
It's amazing that somebody would diagnose a person and then put them on a medication. I mean, I guess it makes sense because it's really challenging to do all the things that you guys are doing over there is so comprehensive and so exhaustive, and it's a lot of work. And realizing this is a holistic person here, and you're looking at their spirituality, you're looking at their
past, their present relationships, where they came from. Yeah,
their blood, their social interactions. I mean, you guys are really comprehensive when you take somebody in. So conventional, medicine, I would imagine it would just be so hard. So it makes sense that they would just give them a drug. But man, these drugs as a first option, it doesn't seem to be helping.
Well,
people.
It might not be a one size fits all.
That's true.
Yeah, it's like, and here's where it's whenever you have progress, and I think we are, from my perspective, we are creating, I think, a more progressive, safe way of helping people's brain, and I think their bodies as well work better for them. But when you do that, and you've got lots of people who've been educated and spent lots of years and hours learning a style of medicine, change sometimes can, like other areas of life, seem pretty anxiety provoking. So I think that's part of what you get with that. From my perspective, the doctors, when they're prescribing medications, they're doing the best they can. That's what they've been trained to do. That's all they know.
Yeah.
And unless you put a large investment of more time into learning, it's hard to keep up. So I think that's where people start asking questions of like, well, why would you use a medication when you can look? Well, I agree. But if you haven't been trained in that, then it's harder. Again, it's meeting with them where they're at and then kind of taking them to a different area.
It's challenging. I mean, for doctors to be, with so many people, if this is a 1 out of 4 diagnosable, then I'd have to think that if 1 out of 4 people are diagnosed with something, that means there's a higher percentage of people that are just living life and not diagnosed at all. So you have this incredibly high demand, and then you yourself have insurance costs and all of that built into your practice, and you are unable to spend time with people. So it becomes, I completely understand. It's just our system seems to be broken.
Yeah, I think here's another thought I'd put in here too. As a physician, we're trained to be very empathic, kind, nice people. And when you're dealing with people with mental illness, for lack of better words, sometimes you have to fight for them.
Oh.
Like people come and see us, and this is one example, okay? So we've got our own outcome studies here. Only one of 2 places in the country, Cleveland Clinics and the Inman Clinics. Only 2 for behavioral health.
Behavioral health. What did you say it's a study?
Outcomes. We keep outcome studies.
Outcome studies.
What percent are getting better.
Okay.
So like people come see us, and and this is a little bit different with medicine, is those that come in, we see about 75% get better. Those that follow us, about 85% get better. Now, this is what I tell them. I told you 100% get better, I'd be lying on my teeth. No one has that. I said, but I'll guarantee you right now, and this is the key, I'll fight for you 100%. That I guarantee. Now, that might sound like a platitude because that's how I do it in today's society. And I tell them when I say that, here's what I mean. 1, if this works, the plan we have set forth, fantastic. If it doesn't, I got all sorts of ideas.
Oh, really?
2, if my ideas run out, you don't want to know what time I get to the office to come up and learn more constructive, safe ways to hopefully help your brain and body work better together. So that way, you're giving them scientific, up-to-date information, but yet you're giving them passion, you're giving them vitality, and giving them a message that you care.
And that's probably the most important one.
Well, if you're out, yes,
Could be.
You're asking me? Yes.
For them to have that feeling that their doctor actually cares about them, because we're so conditioned for the doctor to spend 7 to 10 minutes with you or whatever it is. And
then you leave feeling totally alone on your own journey.
Yeah, exactly.
Yeah. And so we have to come up with systems, I think, on how to do this. How do you create a cost-effective healthcare system that has health, but also has the care piece?
Hey, how does
still in there?
Yeah.
How does one go about finding, because we get listeners all over the world and all over the country, and I know that your practice with Dr. Amen is in, I think, Newport Beach, or Costa Mesa, California?
It's in Costa Mesa, California, yes.
So if someone's listening in New York or in some other state, what do they do? Are there other Amen clinics, or how do they go about finding a place that's at least comparable to what you guys are doing?
Yeah, if there's, in terms of the SPECT scans, which is one of the techniques we use to get a better understanding how the brain's functioning, I don't know of many places in the country that do SPECT scans in the same way we do. So, that all being said, and I'm not just trying to advertise us, but I'm really the only place I know where we do them.
Okay.
We've got an office here in Costa Mesa. We also have an office up in Northern California. We have an office up in Washington, I believe Bellevue, Washington. We opened up an office in Atlanta, Georgia about 3.5 years ago. It's doing real well. There's an office in Reston, Virginia, just outside of Washington, D.C., and then there's an office that opened up 3 years ago in New York City.
Oh, okay. So there's some options then.
Yeah, we're kind of got the East and West Coast pretty well covered.
I kind of just not chuckled inside, but I kind of just was thinking, oh, wow, so apropos to have one in Seattle, because isn't that one of the highest places of suicide?
Yeah, that's true, yes.
So that's great that you guys are there.
Yeah, no kidding.
Yeah.
Wow. I mean, go ahead. Yeah.
No, I'm just curious. So with these scans, I'm kind of changing direction a little bit. What exactly, I'm so fascinated, does this show in the brain that's so different from other scans people could get?
Okay, so when you think of scans, you think of usually CAT scan, or an MRI scan.
Absolutely.
And those scans look more at, if we get say a CT scan or MRI of your brain, you're looking at the structure of the brain. You're seeing where the white matter is, where the gray matter is, where the cerebellum is, where the frontal lobes are, etc. Now, SPECT scans look at blood flow. We use a radionuclide called technetium, big fancy word, but it basically gives you the same amount of radiation as about a third or a half of a CAT scan.
Okay.
And what it does, it traverses through your blood, and then we can kind of follow it and see how much blood flow different parts of your brain are receiving. Now, Dr. Amen, God bless him, he's been doing this for 25 years and has saved 120,000 plus scans over that time. So for those in corporate world trying to think of how much time you spend saving data on electronic warehouses, I mean, this is...
Yeah.
I couldn't believe it. When I first met Dr. Amen, he told me that. I'm like, oh my gosh. I worked for Humana at the time, and it's like, I know what it's like trying to save data. It's not easy. Yeah. So long story short, he's taken this data and then compiled it over the years to understand how the brain's functioning, where it's working too little, where it's working too not enough, and where it's working just right. And with that, he's been able to say, okay, here's somebody who's depressed. What parts of the brain are working too hard and what parts are working too little? And so now we're at a point where we can look at scans, and someone's depressed. They've been on, say, 3-4 medications, been to 4 hospitals. I mean, most of the people we see are the ones that aren't getting better. Let's take a look and see what's going on inside the brain. So we might see there's not just one area, but maybe 3 or 4 that are working too hard or too little. And then we sit down with the patients, walk them through, help them understand the scans, help them understand just how the brain works, different areas. And then we come up with a plan through the use of medications, but I think also more importantly, too, is the use of supplements. We're finding out that actually some supplements can help support brain functioning, and we've seen people get better on them as well. So we take more of a holistic approach to care. The other thing I would add, too, is with the scans, we're really starting to integrate the mind-body whole connection together. So we've hired an internist here, Dr. Mark Philaday, who takes more of a functional medicine approach as well. And then some of us psychiatrists, including myself, we're getting extra courses at the American Academy of Anti-Aging in functional medicine to really understand how brain-body works together. And it's not like a weekend seminar. I mean, this is like
intense,
a lot of time and commitment.
Yeah.
Go ahead.
Well, I'm just so curious. So people, is the lack of SPECT scan, is it a technology thing, or is it like throughout the country or the world? Are people not using it because of the cost related associated with this? Or is it more they just can't spend the time with each patient going through this process?
Well, I think there's a few factors. I think cost is partially there. I think other is just whenever you have a new technology, it takes time for buy-in.
Right.
Both from the public as well as scientific domain.
Okay.
So I think that's playing part of it too. And what it costs to get scans, what I tell at least my patients is when you look at how much money you spent, if you really get better, how much does it really cost? So, for example, we had in Atlanta, two parents brought their 20-something in who's living on the streets, doing drugs, selling drugs, had no motivation to get better. Came in, we got the scans. He was much more amenable when he saw how much less perfusion he had to his cortex from his drug use.
It's kind of nice to see that, isn't it?
Yeah, so he saw it and he started to get it. So he went home, we gave him a plan. He was like 40 pounds overweight too, and he came back a month later and he was a lot more motivated. They said, well, what motivated you? What's got you going? This is when I listen. He says, well, I lost 20 pounds. And I go, that's interesting. I go, so you start thinking how people think. It's like numbers and measuring.
Yeah.
So we use that as a vehicle. So I encouraged him to do some other things. Came back a month later, lost another 15 pounds, and then was looking at becoming a certified trainer.
Wow, isn't that cool?
In a matter of months.
Then he got a certified training, was working at a gym, and then he comes back at 6 months and says, well, Dr. Faber, I think I want to become a Navy SEAL.
Oh, my gosh.
Now, okay, so think about it. This person, the family spent, about $3,500, okay, to watch their kid going from living on the street to wanting to become a Navy SEAL.
I mean, that's amazing.
I mean, it's priceless. Now, I can't say we get that every time. I've been telling the truth, but it's like things like that. It makes the job more rewarding, and I think that's where you get creative. Look at the scans. Look at holistic ways of treating both brain and body, and from a therapeutic standpoint, be empathic, but be an empathic fighter for these people.
Yeah.
And you can see some pretty positive results.
Well, that's interesting. I earlier in the conversation, I'm glad I wanted to kind of touch on this. When you said they brought him in and his will kind of was lacking, how important, I mean, obviously that's a great example of someone who didn't really have a will and his parents kind of drug him in, but do you see a lot more progress and a overall better outcome with people who come in with the will to change versus the kids that get drug in there, or the people who just their family drags them in?
No, I mean, okay, so here, it's like, so part of what we're learning is to answer your question, yeah, if people are more motivated, the likelihood of getting better is a lot higher.
And staying better?
Yes. Okay. Now, the problem is medicine, and I think this is where we're learning, is there's a gentleman by the name of Dr. Prochaska who went through this whole different levels of change, and people don't all of a sudden grow up one day and decide they want to change. They go through a process of wanting to change. Now, when you want to get to the level you're talking about, you're more at an action level of change. We in the healthcare community have over the years assumed people are at the action level of change when they come see us.
Right.
When in actuality, a good majority aren't. And so what does that mean? Does that mean we don't treat, or we start to point the finger because these people aren't at an action level of change? Or instead, do we need to start learning skill sets, how to understand these other levels of change, meet the person where they're at, and help, hold their hand and walk them to get to a place where they're at more of an action level of change.
Mm-hmm.
Okay?
Yeah.
And so,
I love that.
Yeah, so that's where I think the money's at is if we can learn those skill sets. And again, it's a process. I think we're still discovering. We know a lot more than we did 20 years ago, but we've got to learn how to meet people where they're at and kind of persuade them, get buy-in.
Mm-hmm. I wanted to ask you about depression, and because I had a friend who committed suicide in 2004, one of my good friends, and obviously he was severely depressed. And so there's a couple things I'm curious about when it comes to depression. When someone is depressed, there's oftentimes we think of, oh, that's a depressed person. He's an Eeyore. He's just negative and nothing's going right in his life. But then there's also people that are they seem relatively normal and they live their lives and everything's going great. But then, their dog dies, and then their brother dies, and then their parents died, and their wife dies. And then all of a sudden they're just left with nothing. And it seems like, well, being a little bit depressed is a normal thing. Obviously the guy would be upset about all those things. And, but I'm curious, between those two different types of people that are just their whole life, they just progressively get more and more depressed, versus someone who's normal, a string of catastrophic events happens and that person becomes depressed. Is it normal? It seems to me like it would be normal to be depressed for a while for that latter example. But then in both cases, is it something that do you have to actively sort of manage? Like if you all of a sudden you realize, you're 20 pounds overweight, then you start working at it. But is depression like that where it's important to be aware of it? And because in the latter example with the catastrophic cases, is it possible that person could just continually go down that line and get more and more depressed and even suicidal? I just don't know.
No, that's a great question. Here would be my thoughts on it. I mean, we all get depressed. I mean, people are going to die in your life. I mean, you go through bereavement. Now, what I find helpful is listen to mood, listen to the pain, but also you want to look at some biological parameters as well. Okay, so you want to look at things like, well, how are you sleeping? Because if you're not sleeping well, that's a concern, more biological. As you just mentioned, how's your appetite? Are you undereating or overeating? Have you gained 20 pounds? Okay. That tells me we're looking at something maybe a little bit more severe. Mm-hmm. How are you focusing? Are you able to pay attention at work? Are you able to function at work? Are you able to function at home? Okay. And then the final one is, how's your energy level? Are you able to get out of bed, or are you just staying at home, not going out, withdrawn? So sleep, energy, appetite, focus. If you look at those four plus mood, then you can start to kind of put a higher focus on who might be more apt to hurt themselves versus not hurt themselves.
Okay.
That model isn't perfect, but it at least gives you a template on how to start to structure on who might need more help than others.
So with the person that is, in this example, the person that's just chronically depressed their entire lives and no one knows why, the kid has a good life and everything's going well for him, for that person versus the person that has a series of catastrophic events, I guess it doesn't really matter as long as if they recognize their depression and come in and get some sort of treatment, right? Because I think the problem is a lot of people don't recognize it. They just sort of wallow in that.
Yeah, or they don't realize how severe it is, kind of what we were talking about earlier. And then, there's like one more straw that sort of breaks the camel's back, and then boom. Oh, my Lord, how did that happen?
Right.
They ended up hurting themselves.
Right.
So there's an educational component. See, what you're talking about, it'd be like, okay, what is the difference between major depression versus bereavement? Okay. And people go through bereavement. Do some people with bereavement go from being bereavement to major depression? Yeah. Okay. So what are the factors you have to look at? What are the signs and symptoms you have to look at? It gets into also, from a healthcare provider standpoint, is you want to educate, but you also want to be aware yourself. You have to ask deeper, more probing, watchful questions to make sure the person is on a path of recovery and not one of, deterioration, as well. So it's a way of thinking too, I think, for the physician, to look at all the variables and realize that, life isn't static. I mean, things go up and down. And when you get so busy, sometimes your focus is so much on, okay, I got 7 to 10 minutes or 15 minutes, whatever. Let's look at the data, the labs, etc., which we need to do. But simultaneously, you got to ask, where's this person going? Mm-hmm. Are they getting better? Are they getting worse, or are they staying the same?
Yeah, I love what you guys are doing, because it's one thing to, I know your preference is obviously to not use medication, but, that's obviously something that you guys do a little bit, but I just love what you're doing, because it's so cool, because it's one thing to bring someone from negative, they're negative 10 or in their depression or whatever, and it's one thing to bring someone up to a level of 0 to baseline. But then it's really cool that you guys are also like this story of this kid that went to go into the Marines. I mean, it's awesome, because within each of us is this desire to help and to serve and to make the world a better place. It's just that we sometimes get so bogged down in our own lives, we can't, we get so depressed about the way our life is going. But it's great that you guys aren't just bringing people back up to baseline. You're bringing back people to a place where they're going to serve.
Yeah, exactly. Okay, so two things. One is, in terms of the medication piece, just for the scientific people out there watching, we're not opposed to meds. We'll use meds. Mm-hmm. We just want to make sure we're using them safely.
Right.
We see people coming on 3-4 different psychotropics plus whatever other medical illness. That's where we get more concerned. So there's that piece. Now, what you're just mentioning is this. There's symptoms. We get all the symptoms better. Hooray, hurrah. Come back in 6 months. Okay, that's not how mental health works. You get the symptoms better, but then there's all these quality of life issues which you're hitting. Hooray, your depression's better. Now I got to help you find purpose.
Right.
We have to help you find some meaning. We have to help you get some enthusiasm, like you're doing something that's helping you and helping others. So that's where I think we will go the additional step to help that person continue to grow. And is that not how all of us are anyhow? Right. None of us like to stagnate for long, at least from my opinion. We want to continue our journey of growth and vibrancy.
Mm-hmm.
Right, so, not just survive, but thrive. Why are we here?
Yeah, what are we doing?
Yeah.
What are we doing?
Mm-hmm.
Right?
Yep.
Yeah, I wanted to ask you too, I mean, you guys work with some incredible, I just was reading this list, and it's like there's so many issues with brain, OCD, and I think of that movie with Jack Nicholson, remember, where he was washing his hands with a new bar of soap every single time he washed his hands, and wouldn't step on the cracks, of the sidewalk.
Was that Bill Murray?
I thought it was Jack Nicholson, or maybe it's Bill Murray. I guess it doesn't matter.
What about Bob?
But there's so many people with OCD and these types of behaviors. And you guys work with all these types of situations, don't you?
Yeah, we see, in some of the OCD, we've got, some who are just, washing their hands, that's a problem, but we've got a lot who aren't able to get out of the house or work, or their houses are a mess because they're hoarding.
Right.
So, so the stuff people don't like to talk about are the things we oftentimes will see at our clinic. So
when you see someone who's, for example, like you said, hoarding and their OCD, when you do scans of their brains, is there anything different in their brains?
We see an association. There's a part of your brain called the anterior cingulate cortex. It's more in your frontal lobes, but much deeper down.
Okay.
That if it's overactive, meaning it gets a whole lot of blood flow, we see a higher association with people having a lot of obsessive thoughts, getting stuck on thoughts, just can't let go. So we know that part of your brain, when we see it overactive, is requesting more serotonin. And so we typically use, serotonin agents to try to help that part out. Now, whether that be a medication like Prozac or Lexapro, Celexa, or there's supplements you can use. Again, depends how severe the OCD is. If they're not functioning, well, then you probably want to use a medication. But there's supplements like 5-hydroxytryptophan, the precursor molecule to serotonin. saffron, St. John's wort. That's probably the one most people have heard of.
Yeah, right.
As well.
So you look at someone's individual scans and their particular issue, and you decide if you should do the medication first or second, or herbs first or second, and you kind of make that determination based on a case-by-case situation? Yeah,
case-by-case. I mean, we use the scans as a guide, but we really look at the functionality of the person. I mean, if their OCD is so bad that they're staying in the house, not going to school because they're washing their hands every hour, well, that case, functioning-wise, you get a little bit more concerned about.
Is it an issue with people with these types of OCD or depression? Is it an issue for them because it seems like their brain would be exactly the type of brain that would become addicted to those medications and feel like they couldn't operate without them? Is that an issue?
No, that's a great question. I mean, what we see is this, is in terms of the antidepressants and them being addictive, we just haven't seen it. The data, the research hasn't supported that out.
Okay.
We do see, though, people that get stuck, some of our substance abusers, that part of the brain's real active.
Oh, right.
They get stuck on, they want to stay sober, but they constantly think about alcohol. They can't get the thoughts out of their head.
Wow.
So they're kind of plagued to drink. We talked about road rage earlier. Okay. So the road ragers, you're going down the 405, someone goes in front of you, almost hits you, upset, understandable. But then you're still following that person down to San Diego. Okay.
We've all wanted to, let's be honest.
You're so stuck on that thought.
Right.
You can't let go. Now there's a problem. And we that would be when we think, hey, maybe that anterior cingulate's working too hard. You get obsessed, you get stuck, you can't let go. We'll see kids, okay, who mom and dad will say, go clean your room. The kid says, I want to play. Clean your room. I want to play. Clean your room. I want to play. Clean your room. I want to play. So you get this bantering going back and forth, and the parents thinking, they're just trying to wear me down. All they're trying to do is get me so I'll finally say, go play. When in actuality, the kid's not doing that. Their anterior cingulate's so active, they're stuck. They're mentally rigid. They can't think of other options, okay, to do. And so that's where you look at maybe doing some, individual therapy work, but then you'd look at ways to help enhance serotonin in your anterior cingulate as well.
Now, what role do lifestyle changes, like I would imagine for the hoarder, it would be super beneficial to have someone come in and just like that TV show where they help people get rid of their attachments to things or meditation. But I would imagine meditation would be something that someone with OCD would be even able to do. But I wonder, some of these dietary principles and lifestyle principles, I know they play a big role in your clinic, but how big of a role? I guess it depends on each person, doesn't it?
Now, it really depends on each, person, on what they need. This is just from my own experience because I don't have as much data to back it up. But people who get really angry, we see a lot of temporal lobe problems there. If your body, and this has been from my experience, and I think it makes common sense too, is in a more oxidized state, you're more likely to get angry. So if you're not sleeping and some stress, you're going to be more apt to get irritable and frustrated. Okay. So your body's in more likely an oxidized state. So the more you can incorporate a diet that's more alkaline in nature, would that not make sense to help improve the overall physiology of those temporal lobes? Okay. So what do we know? We know, like, for example, if you eat a lot of vegetables, especially cruciferous vegetables, we're finding out some of the phytochemicals bind to the DNA. And there's a gene called NF-kappa beta, which I'm not going to go into all the details. But if the vegetables bind to the DNA, that gene is not produced, and your body is less apt to make inflammatory products. Okay, so which means if you have less inflammatory products, your brain's more alkaline, less oxidized, so you're less likely to get angry and irritable.
Interesting.
Wow.
That makes sense. So drink your green juice.
Drink your green juice, okay, or alkaline water,
Right.
Okay. You
Small
can drink
changes.
alkaline water, or small little changes, but again, they all add up.
Right.
I can't afford alkaline water. Okay, fine, do this. Go to the grocery store. I want you to buy some limes.
Yeah.
Take go get a pitcher, fill it with filtered water. If you don't have a filter, just fill it with water. Take that lime, cut it in half, squeeze out the juice in each half into that water, let it sit overnight. Boom, you got alkaline in the water.
Yeah, and just like that.
Right. So there's always options for people. Always options for people.
Yeah. So diet, I think, plays a big part to answer your question.
And I would imagine a spiritual practice too. Do many people? Is this something that's introduced as something new to them? Because I wouldn't imagine that people would have a spiritual practice that would need to come to see you. But maybe that's the case.
I'm sure.
Yeah, I mean, we don't profess to be pastors or, leaders of synagogues, but we do find that the spirituality piece, and there's data to support this, is really important. So having purpose, having hope, helps your mental health.
Yeah.
And so wherever you're at in your own spiritual realm, we try to get a sense and then help those people. I do believe this, though. I'm telling you, there's all sorts of different attachments. There's a secure attachment where you grow up, mom and dad are close, they're empathically attuned, blah, blah, blah. Your conceptualization of your higher power tends to be more secure, okay, because of that. As opposed to a home where, let's say, you had mom and dad arguing a lot, they were kind of critical, so you as a child, you learned just stay away, so, and we've seen this attachment, they got their stuff. I'll do my own thing. Thank you very much. They're not mean or nasty, but I'm going my own way.
Right.
So they get that. And then they might see the home as sort of unpredictable as well. So what happens? Your higher power becomes, someone you don't get close to, kind of keep distant, and you see it as more unpredictable. So,
gosh, that makes so much sense, doesn't it?
It does.
Yeah. How can it?
Yeah. So
how can
the
it
more
not
we can
translate
help
to that
people
area?
understand their attachments, and it helps you get a more secure attachment. But again, this is my own personal feeling. And this, by the way, I'm getting ready to write another book. I'm going to have a big chapter on spirituality.
Nice.
And this is going to be one of the concepts, is that having secure attachments or learning how to develop that, I think, is going to be important.
Yeah, I know for me personally, a big part of my evolution and growth has been the spiritual piece to the things that you learn throughout your time. If you're constantly searching and learning new information, much of it becomes overwhelming and much of it becomes, I guess, negative. And so personally, having a spiritual foundation, and having, I really enjoy, I'm sure you're familiar, Dr. Faber, with Jim Rohn, but he had a great series called The Challenge to Succeed that my jiu-jitsu instructor gave to me years ago, and it was just an incredible, it really changed my life, and I really connected with that 4-hour talk that he gave. But reading books, like The Four Agreements and these types of things really help you kind of, at least for me, kind of detach from what's going on around me and to deal with stress better. And I would imagine that this would be a part of the things that you're going to do with these kids as well.
Well, like with Brain Source, yes, and I can just tell you from personal experience, I'm 57 now, since age 40, I read probably 2 to 3 leadership books a month now.
Oh, wow.
My gosh.
Yeah, every morning, and I read, and then I journal. I either do a left brain journal where I'll talk and type. I don't type anymore. And kind of, this is what I'm thinking. Here's my day, blah, blah, blah. Or I'll do right brain journal where I'll go into Microsoft, OneNote? Yeah, OneNote.
Okay.
And make mind maps of what I read. So it's like if I'm reading about, say, resilience, I'll make up resilience. They talk about hope. Well, what's hope? That means, one, having passive hope, good attitude, being optimistic. Arrow, am I doing that? Yes. Well, why am I still not having hope? Well, the book, what does the book say? It talks about active hope. What's active hope? Another arrow. Making it happen. Not just staying passive, but doing something. Arrow, how well am I doing this? And you have fun with this? I'm not doing well this at all. What does the book say to do? So, now this gets back to what you're talking about. So I've done this for 20 years. My OneNote and Microsoft Left Brain Journal, I've got everything stored for the last 8 years. So I can go in and go like OneNote and type, I need something on hope. And I type hope, and all of a sudden I've got about 8 entries where I've got higher order thinking, books I've read, and then that I've incorporated into my own personal life. So it's like your template for your own life, how to do life.
Wow.
I like that. Microsoft OneNote. Yeah. That's a cool little thing.
OneNote. Yeah, so then you've got everything there. But it gets back, then you become more the person, like you're talking about Jim Rome, how you felt like after you read that book.
Uh-huh.
Yeah, what if you did that every day?
Yeah.
I know, right?
Oh, my gosh. And then you start, the weird thing is when you do this, this is just me personal, is you begin to see how much you've been living life as a victim and lived life feeling this entitlement as opposed to taking a constructive accountability for yourself. And it becomes fun.
Yeah.
It's not like, oh my gosh, I'm this horrible. It's like, oh my gosh, there's so many things you can do differently.
Mm-hmm. And you realize
a great adventure instead.
Yeah, we have the power.
Yes.
Yes.
Yeah, and it's an adventure. All right, Dr. J, thank you so much for spending some time with us. I want to let everyone know your two websites are Amen Clinics, AMEN Clinics.com, and then the other one is Dr. J Faber, DrJayFaber.com, right?
That's correct.
That is so cool. And so if people actually want to work with you personally that listen to this, is that possible?
Absolutely, yes.
And so they would just make a consultation with you here in California?
Yes.
That is awesome. And I just saw on your website you just finished, now this may be old, but you just wrapped up a book. Is that correct?
Yeah, real quick, book, Escape, Rehab Your Brain to Stay Out of the Legal System Forever. It's a book primarily written for people in the legal system and how they can rehabilitate their brain to never go back to prison or jail again.
Oh, wow.
I wrote the book for free, so you can go down that my website, download it, and I purposely wrote it for free because the people who need it the most can't afford it.
Yeah, that's so true, isn't it?
Yeah, it's my thank you to, I wrote it for three reasons. One, for the prisoners. Two, believe it or not, the taxpayers. I'd like to see all of us spend our money more constructively in other areas than the correctional system. And then third, it's my thank you to the U.S. government, which sometimes I think we take too much for granted. They did, after all, pay for probably half my medical education.
Oh, wow.
Yeah, I mean, through loans. I mean, they did a lot. So it's my thank you to them as well.
Good for you.
That is so cool. So drjfaber.com. Thank you so much, Doc. Stay on the line there, and we're just going to close out the live show, or not the live show. We don't do live shows anymore. But we're going to close out this show. I want to thank everybody for joining us. If you want access to those websites, we don't do show notes anymore, but you can go to extremehealthradio.com/441, and that will be the show number for this particular show. And you can click over to Dr. Faber's website's there. And thank you for listening. Thank you for passing the show on to your friends. If you know anyone who is dealing with any of these issues, as a favor to us, Dr. Faber, as well as to Kate and I, please pass the show on to them, because I think there's some real valuable information, and then you can look further into the types of work that they do over at the Amen Clinic. So please pass the show on to them.
Because everybody needs more hope.
Everybody needs more hope. That's what it's all about. So thank you for listening, and let us know if we could ever help. We appreciate you guys so much, and we'll catch you guys on the next episode. Okay, so episode 441, Dr. J Faber. Interesting guy, right?
I always say this, but I like a lot. I love our guests. They're awesome.
Yeah.
He was amazing. Yeah, I was saying, right when we first started, when you muted us before, when we were playing the music intro, I think he's the perfect amount of mellow and knowledge and conversation. And he's a great guest. He was easy to talk to. His heart for people, I think it's just he's a front runner in the spreading of the message of hope. And that's why I believe he's sent to this earth. I mean, the credentials, the doctorates, whatever he has.
He's a medical doctor.
He's a medical doctor.
Yeah.
But I just think, gosh, all that's great. But if you don't have love in your heart for people, and you don't, it's like he's starting to get to the nitty gritty of what do we do about the next generation coming up? How do we meet them at their level? It's just, that's where cool. Real change is going to happen, in my opinion. But
yeah, I like what he's doing with stuff. That. He's going into the hood. Yeah. And got that, he has a house for kids. I think that's super cool. I think that's a good idea. I think that, I think it's bizarre to me, though, that when we talked about during the show that, 1 out of every 4 people have a neurological, what do you call that? Diagnosable neurological condition. And then we're talking also about how I think 1 out of every 2 people are on some sort of pharmaceutical.
It's hard to believe.
So I'm not sure what but that's so many people. That's everybody you run into.
It's hard to believe and then totally easy to believe at the
based
same
on
time.
people's
behaviors that we witness around town in our daily lives. But
I really like what he's doing, because there's not a lot of, I don't think we've talked to a lot of people, have we, about neurological brain issues? I know that we talked to
somebody about brain health, haven't we?
Yeah, I know we talked to Dr. Mary Newport. Were you on that show where her husband had Alzheimer's? And she was able to make a really great...
I don't know if I was on that one.
Really, she made really great strides with her husband. I'm not sure if she completely... Reversed it, but with coconut oil.
Oh, man. Why am I not... I don't remember if I was on that one, to be honest, or not.
We've talked to David Steenblock. He's really great.
Oh, yeah.
In studio.
That's right.
And...
See, a lot of that, though, is interesting because that's more the medical side of, not the psychiatric part. It's a lot of the brain health, what foods we eat for our brain.
Yeah, Dr. Jockers talked about that.
Mm-hmm, which is an important part. But, man, it's almost like if you have all these stuffed down mental, emotional issues and dealings that you haven't dealt with in your heart, just this unrest and division within yourself. I don't know if it matters how many walnuts and coconut oil you eat and drink, and try to pull things out of your brain. I mean, I think that stuff's really helpful, but my gosh, I think it's a twofold problem that needs to be addressed for people.
Isn't it bizarre? I like their approach, the 4-pronged approach they have, but it goes deeper. It goes into blood work. It goes into social connections and how many friends you have and how your friends view you and how you view your friends. And it gets into part of what they do is they look at your vocation. They look at your spiritual connection. They look at your food, your diet, your lifestyle, and, the amount of sleep you get. So it's like, it's such a comprehensive, and then the emotional, spiritual side too with everything. Mm-hmm. We know so many people that have depression, anxiety. Think of all the people that are just dominated by fear.
Well, we were writing notes back and forth during the show, passing a note with a name on it, like, what about this? That's totally for this person.
Yeah.
What he just spoke about is totally that person. Man. I mean the anxiety is rampant. We live in a crazy age where there's a lot to be anxious about, and it grips people, paralyzing them and leaving them just feeling stranded and unable to move forward in any aspect of life.
Yeah, it's really crazy. I mean, you think about all these mental mood disorders with anxiety, depression, that list I read, OCD, temper, people with temper issues or addictions, negativity, bipolar, ADD, Alzheimer's, poor memory, autism, concussions, all these things that people have, but it's almost like we don't, maybe we have some weird fear that we don't know where it comes from. And then we're just sort of thrown into this life with no real tools to be able to deal with the things that plague us.
Right.
I
thought it was really interesting. It was funny, but interesting what he said about, you're driving down the 405 and somebody cuts you off and you're really upset. And, you get a little road rage, you follow him for a while and make it really known. But then he goes, you don't follow him all the way to San Diego from LA. I mean, that's a whole other level of crazy.
You're right.
Clearly, you're a very angry person with bigger issues than someone cutting you off. But it's funny because I agree. It's not right to have somebody just punch you in the face and you're okay with it. Jesus might not agree. He might say, turn the other cheek and move on. But I mean, I wouldn't be happy if somebody did that. I could forgive them and I could get over it. But your natural reaction and inclination is to get even and to, I think there's an important part of addressing rightful anger. Like, I believe that if you don't let yourself ever be angry, you have just as much of a problem as pushing things down. I mean, you're not healthy and not releasing anger.
Totally.
But I think it's that threshold that people cross, that it becomes a dangerous situation to themselves and others. And that becomes these people who, become mass murderers and, following somebody 3 hours in a car just to right the wrong. And, I thought that was a good example, though, where I thought it's not a bad thing to experience human emotions. It's how we let things go and how quickly. I'm reading the best book right now.
Yeah?
The Untethered Soul.
Oh, by Michael Singer?
By Michael Singer.
Yeah.
And the main premise is, it's okay to be human, but the quicker and the faster we allow these things to pass through us, we're going to recover.
Oh, right.
We're going to be okay. It's the letting go and how we open ourselves up to be a conduit of that movement. Through us.
That's a good point.
It's almost like reading a really heady paper, but easy. I mean, it's heavy and it's heady, but it also is really, you're fascinated by it, so you kind of blow through it. But
it's like a simple concept, right?
Yeah, like the Four Agreements kind of thing.
You know what's interesting about like the example of driving down the street or driving on the freeway and having the guy cut you off and you get angry. Like there's a switch that goes on. Maybe 100 out of 100 people would get angry at that guy. But then after a few moments, most people will just let it go.
Right.
But then there's some sort of switch that turns on and someone's saying, okay, I'm going to follow this guy. Mm-hmm. And then it becomes this thing where like you continue to follow them. So let's say you're driving from LA to San Diego to follow after this guy. And this could be an example of anything that we have in our life. The act of continual, because he could at any moment, he can just get off the freeway, right? And say, you know what, screw this, not worth it. I'm going to just get off the freeway. I'm going to go back over and go back home the opposite way. But the act of him continually choosing to do that mm-hmm. is a practice. And it's weird because we don't think of these things like we think of spiritual practice or we think of practicing basketball or practicing guitar, but we don't think of unconscious choices that we make every single day as a practice. So if someone were to do that, I mean, I'm just as guilty, not of doing that, I've never done that, but just as guilty as anybody else. But if we continually give in to those things, we're practicing getting better at those things too. Like we're practicing getting better at holding on and having grudges and continuing to identify.
Feeling justified in these behaviors.
You don't think about it like that. You just think, oh, I'm following this guy and I'm going to beat this guy up when I see him or something like that.
Right.
But you don't think about like I'm practicing the art of getting better at becoming more and more spiritually unconscious and more depressed and more whatever it is. Like you're even though it's a negative thing, because you think, oh, I'm practicing getting better at something.
Right.
But you're also practicing every day, all of us, at getting bad at things too.
Yeah, you're right. I mean, that's every time we choose a ruminating thought, we're choosing.
You're practicing.
To relive it, which is practice. I mean.
It's a weird thought, huh?
That's interesting. I'm glad you brought that up.
Yeah, we just have so many people in our lives. I mean, yeah, I just think what he's doing is awesome.
I do too.
Dr. J. Faber.
I want to catch back up with him after the nonprofit and see how that house is going, and God bless him for taking on, another man's vision that had passed on and bringing it back to life, because there's such a need more than ever in this world.
Super cool.
I believe.
Super cool. All right, that was Dr. J. Faber, drjayfaber.com, or you can find him at amenclinics.com. And he's working over there doing some of his practice over at Dr. Amen's clinic. Excuse me. If you would like to listen to this show on our website, you can do that at extremehealthradio.com. So that's 441. All of our shows are free. And if you are listening to this, please consider supporting us via Patreon. We would greatly appreciate that. It helps us tremendously. I think what happens is a lot of people think, oh, if I donate 25 cents a show, or, if we do 4 shows a month or 12 shows a month, or I've put a cap on it for, $2 a month, that's not going to really help, And I think that's the kind of mindset that a lot of people have. And I know I think like that too. Oh, what is it going to help if if I donate $1 a month? But the more people that are able to donate at that level, it really helps us. And we'd actually rather have more people support us at that level than less people support us by giving, $50 a month or whatever it is.
Just it's like it goes against everything.
Yeah.
That you'd think would matter, but no, it's the small reoccurring things that people are able to commit to that
help.
Oh, we're thrilled when we get people supporting us. So.
Yeah, it helps us a lot. And all of you guys also supporting us on Amazon by shopping through our link and thinking of Justin and Kate every time you buy on Amazon. That really helps us too. So we really appreciate it. And
good old Justin and Kate.
Good old Justin and Kate. And thank you also for your purchases through our store with all of the great products we have on there. So we appreciate you guys so much. Is that about it?
I think that might be a wrap.
Awesome. All right, guys. Thank you so much. And we'll catch you guys on the next episode.
Hey, everybody. This is Josie, Justin's mum. Don't tell him, but I know he would absolutely be really happy if you would sign up to his free weekly newsletter. And don't forget to share this with all your friends. This is the buzzing bumblebee signing off.
Oh my gosh.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this blog or to start any health program without first consulting a health professional.